4 things to do if you have a toilet infection. The question is there anything really like a toilet infection? Is there anything they do called toilet infection? That is the misconception most of you don't understand. When you say toilet infection, there is nothing medically is referred to as a toilet infection. It is either urinary tract infection, which they are very many. Like there are many urinary tract infections that can affect you as a woman or as a man. There is nothing like toilet infection. We need to get that into our brain. Toilet is not causing an infection, so that you not be scared of going to toilet using toilet. Toilet doesn't cause infection. Please get that. So before we go into what are the things you need to do if you have this urinary tract infection before going to the hospital, is we need to understand what are the causes of this infection. If you look at this urinary tract infection, the major causes are usually bacteria. They are caused by bacteria, and the most bacteria that usually cause it is Escherichia coli, the one we refer to as E. coli. That is the bacteria that is responsible to cause most of the urinary tract infection. You see, your urinary tract, they are divided into two. We have the lower tract and the upper tract. The upper tract, that is when it begins from your bladder, that's your ureter, to your kidney. Then the lower tract, it begins from the lower part of your bladder, your urethra, and your sphincters. That is the opening into your vulva or the opening into your penis. So this is the lower part of your urinary tract. So if at all they come in contact with Escherichia coli, that is E. coli, that is when urinary tract infection now come in. So nothing like toilets causing an infection. So get that misconception and don't blame yourself because somebody used your toilet. You feel you have toilet infection. That is a lie. So it is only Escherichia coli that can cause you this urinary tract infection. Then who is this urinary tract infection more common to? Women are more prone to urinary tract infection. Do you know why? Because you see, women, their urethra is very small. It is just about 4 centimeters in length compared to that of men. You see, that's why you see most of the time women are always found in the hospital. Most time they get that we get treated, because they are always very, very prone. They have short urethra. So in that case, their urinary tract is more exposed than men or the guys. Guys, we have our 20 centimeter in length of our urethra. But you see, ladies, they just have 4 centimeters. So that is why they are more prone and they are at risk of urinary tract infection compared to men. Then when you now have it, what do you do? Number one thing you should always do is you should always make sure you drink a lot of water. Drink a lot of water. Stay hydrated always. When you have urinary tract infection as a woman, it is very, very advisable that you should take enough water. You don't know where and how this will help you. Taking water or getting yourself hydrated will help to remove toxins. Aside other benefits of taking water as a human being, it improves blood circulation, it helps in building muscle mass and everything. It also helps your urinary tract system or urinary tract cycles. Because when you take water, when you take enough water, when you stay hydrated, it helps to flush out those toxins. Because some of these infections, sometimes it doesn't just come from external source. Sometimes it is built up internally due to these toxins that are stored within your bladder that we are not able to flush out while your urine are going out. So they stuck behind. When they stuck behind, they are the one that develop into an infection. So when you take enough water or when you stay hydrated, it helps to wash out those infections out of your system completely. So you see that even taking water, it will serve you enough benefit. That discharge you are having, that smelly urine you are having, it will help to reduce it. That is one. Then 2, if you have urinary tract infection, always make sure that you clean yourself properly. Maintain hygiene. Hygiene is very, very important. Some of you use the toilet after urinating, you get up, put on your panties and start moving on. No. After you make use of toilet, make sure you wash yourself under a running water. Don't use tissue paper. The era of using tissue paper is past. Use water, running water to wash yourself. Then while you wash yourself, make sure you wipe from the front to the back. You don't wipe from back to front. You are wiping back to front. You are actually taking some of those deaths from your anus down to your vagina or to your vulva as a woman. So always make sure when you wipe or when you wash yourself, you wash from back to the front. That is the idea. So aside you washing yourself or making yourself or making hygiene or good hygiene, another thing that is very, very important for you as a woman is immediately after sex, always try to urinate. This will help you a long way. When you urinate immediately after sex, it will help to actually remove whatever remains that is present during coitus. Those fluids that remain, your seminal fluids, your vaginal fluids, those ones that are being secreted when you are having sexual intercourse. So when you urinate, you will have to excrete and wash. It will help you wash them away from your vulva, because if those things are stored back there, it build up and infection can set in. And once infection sets in, urinary tract infection, you start having discharge, start having itchy vagina and all of that. That is another important thing that you need to put into consideration if you are usually having, or if you are always having, urinary tract infection. And last but not the least, thing that you should always do if you have a urinary tract infection is never to take any unprescribed medication. You go to roadside, you tell them that the roadside pharmacy, you tell them you have itchy or anything, you just get drugs or anything. That is not advisable. Most of the urinary tract infection are similar. It could be bacterial vaginosis, it could be candidiasis or anything. It could be any bacterial infection. It could be a yeast infection, you don't know. But when you go to roadside pharmacy and you get drugs to get yourself treated, or you start taking drug, at some point those infection or those bacteria that causes the infection can resist those antibiotics, can resist those drugs, and at the end of the day, when you are subjected to treatment after sensitivity, they don't get rid of you. So stop getting roadside drugs from the pharmacy to get yourself treated. Go to the hospital when you start having the signs and symptoms of urinary tract infection, such as itchy vagina, burning sensation, and all of that. Kindly share this video to every other person out there. It will benefit them. It will benefit them definitely. So don't keep this video to yourself. Make sure you subscribe to my channel if you've not done that. If you're just new to our YouTube channel, make sure you like, subscribe, and I'll see you in the next video.